Well, this morning, COVID booster shots are one step closer to reality for millions of people. The FDA giving emergency authorization for a third dose of Pfizer's COVID vaccine for high-risk people. Previously, it had just been recommended by an FDA committee. But that authorization does not mean people could start lining up for their third dose. The CDC still has to weigh in. Their meeting about the Pfizer booster shot continues today. The CDC's main task is deciding who exactly counts as high risk and is therefore eligible for a third dose. Wake Up Charlotte's Richard Devane joins us live. Richard, all of this is going to have a big impact on when people here in the Carolinas can receive a booster shot.
Absolutely correct, Sarah. Good morning to you. Good Thursday morning, everyone. Yeah, basically the FDA has weighed in, and now the CDC will give details as to the Americans that it says can get that third dose of the vaccine. But of course, it's only limited to those who've taken one particular vaccine already. The U.S. Food and Drug Administration says it would grant emergency use authorization for a booster dose of Pfizer's COVID-19 vaccine in people 65 and older and those at high risk of severe disease and people whose job puts them at risk of infection. The FDA's decision means anyone over the age of 65 could get a booster, as well as people as young as 18 if they have a medical condition that puts them at risk of severe COVID-19. Or if they work a frontline job like a nurse or a doctor that makes it more likely that they could get infected. But the FDA's decision is only for those who initially received the Pfizer vaccine, not those who got Moderna or Johnson & Johnson.
This is not the situation where we want to be, where people are eligible or not eligible based on which vaccine they got. I think it'd be really helpful for the FDA and the CDC to come out with broader guidance across a range of vaccines.
Yeah, but right now that's not going to happen. Basically, the CDC will recommend in detail the groups that it says can get that booster dose. And of course, it's limited to Pfizer. They say as far as Moderna and Johnson, that could come in a few weeks. Right now, we're reporting live in Uptown. Richard Devane for Wake Up Charlotte.
It's a lot to keep track of. Richard, thank you. Let's take a look at COVID-19 by the numbers. New data from the health department shows more North Carolina schools are dealing with COVID clusters. Remember, a cluster is 5 or more cases that are believed to be linked together. Right now, 77 schools in the state have reported COVID clusters. That's up from 47 just 2 weeks ago. In our area, Mecklenburg, Union, and Rowan counties have the most schools impacted with 10 each. Union Academy Charter School still has the largest COVID cluster in the entire state. The health department says there are 78 linked cases among students and staff. There were over 100 cases there 2 weeks ago.